Health informatics, the use and implications. Two important definitions that we covered in this week's readings were healthcare informatics and nursing informatics. Healthcare informatics is the integration of healthcare sciences, computer science, information science, and cognitive science to assist in the management of healthcare information. Nursing informatics uses the same intersection of disciplines to manage and communicate data, information, and knowledge in nursing practice. To illustrate the usefulness of healthcare informatics, the University of Manchester conducted a study on patient data recording. Patients with rheumatoid arthritis used an app to record their daily symptoms, and this information was accessible to their doctors through an online database to improve consultations. Using this technology, doctors were able to learn about patients' RA flare-ups that the patient may have forgotten or neglected to report to their doctors. In my opinion, education in informatics is essential to improve healthcare and to create new methods of data collection, such as the app in the University of Manchester study. Healthcare providers should continue their education within the informatics field to be active members in creating and integrating such systems. However, they should keep in mind the clinical, managerial, and policy implications.
When evaluating the clinical implications of health informatics, we must look at the applications in online portal systems, electronic medical records, data collection devices, and more. Providers have been incentivized to use electronic health records. This has been due to the fact that President Obama signed the American Recovery and Reinvestment Act, which included the Meaningful Use Program. This program financially rewarded providers when using electronic health records. The use of electronic health records also allows for increased amount of patient data, which would improve the overall comprehensive evidence-based care. However, with this increased use of electronic health records, there's also an increasing mass of data that must be analyzed and looked at by healthcare informaticists. Because there are not that many healthcare informaticists, there's an increasing need for this career. Overall, clinical implications have shown positive results through healthcare informatics, which can better be improved through further outcomes and improved careers.
Looking at things from a managerial perspective, healthcare and nursing informatics play a massive role. Nursing informatics streamlines the communication process, making it easier for nurse managers to gather and process information. It also allows more data to be collected at a faster rate, meaning they can process and categorize more EHRs and make medical decisions more efficient. For example, in the study conducted by the University of Manchester's Collected Health team, they were able to collect a consistent and comprehensive history over an extended period of time, thus allowing them to see changes in symptoms and making the consultations more meaningful. On the other side of the coin, healthcare informatics helps the administrative processes such as payroll and inventory. More data collection and manipulation means more efficient processes can be made and implemented all across the board.
The amount of data available can now be utilized by policymakers to inform their decision-making when crafting new policies. Public health officials and policymakers still have much to learn to appropriately utilize these new data. Following state and federal regulations is vital to the use of electronic health records or mobile applications, as they may increase the potential for liability from a breach in privacy. The policy implications of well-managed data do hold great opportunities for the increased health of patients, as demonstrated in research done at the University of Manchester. Those researchers found an increased ability to individualize patient visits, lending credence to changes in policy guiding doctors' visits. It is my opinion that a multidisciplinary approach will lead to the greatest benefits when creating new policy informed by data.
As health informatics students, we believe the clinical, managerial, and policy impacts will be largely positive if individuals with medical, technical, informatics, and nursing backgrounds work together to implement usage of EHRs and other new technologies to improve patient care.